Okay, so in this video, I want to talk about what the actual range of motion of your hips is and what you can do with your hips or should be able to do with your hips. Okay, so now in saying this, this is the perfect hip joint that does not have any deformities in it or bony protrusions that have been built up because of things you've done with your hips. But the healthy hip joint should be able to do these movements, okay? So when we think of movement of the hip, we think of flexion, which is coming this way. So when you are bringing two muscles together, so this is coming up towards this, okay? This is flexion at my hip. This would be flexion at my knee because these are coming together. But as far as the hip, when you step forward like this, okay, you're dealing with flexion at the hip. When you go into a a squat, this is flexion at the hip that you're dealing with, okay? So you have to have that flexion. How much flexion should you have? You know what? We can get into the numbers. Flexion, about 125 degrees, okay? So if you laid me on my back, brought my leg up, I shouldn't be able to just go 90. I should be able to go a little bit farther. Is everybody gonna do that? No, that's the range. Some people, if you get them up to 90, they're doing awesome, okay? If you took the session with Ashley here at Spray Lakes, we learned that when we fall, when you see a child fall, the reason that they don't hurt themselves is they collapse down like this, right? Because they have that flexion at the hips. When we lose that flexion at the hips, we fall like this because we just can't get our knees to come up to our body. So that ability of your knees to be able to come up to your body, your knees, it's coming from the hip, right? Remember? But when I say my knee, it's because my knee is moving. This comes from the hip. That ability to do that without doing things like that and compensating is huge, okay? So that's flexion. Extension comes to play when we walk. So this is extension. So if I don't have hip extension, what's likely going to happen is I'm not going to be able to use my glute muscles properly. And if I can't use my glute muscles properly, guess what's going to take the load? You know, and if you have walked for hours and you're like, oh man, my back is killing me. Is that your back being bad, or is that you probably have something going on at the hips? I say it's probably something going on at the hips. You're probably not extending properly when you walk, and that's what's happening, okay? You see this in the oldest of the old. Okay, that's the new term. The oldest of the old. So those 90-year-old guys, they lose hip extension. They walk like this. They also lose dorsiflexion in their feet, so they shuffle while they walk, okay? So they walk like this. And then, of course, because they're not moving those hip muscles, everything's tightening up, and now they're back down here, the hip flexors, and they're walking like this, okay? Is that a safe way to walk? No, absolutely not. But it is something that naturally happens, not because of age. Don't give me that crap, okay? It happens because of lack of movement, lack of use. Perfect example of hip mobility. Marilyn Banting. She comes to classes faithfully. She is going to be turning 80 years old, and you would not know that that girl is 80 years old the way that she moves. You get her doing yoga poses, hips, she shows off like crazy. She is awesome, and she has that mobility. And if she can keep that mobility, she is going to age really well because she's going to be active and she's going to enjoy the quality of life. Is she going to have some aches and pains? Yes, of course. Okay, we all are. So that's the importance of that extension. The other things that your hips do at about 45, that's about 115 degrees that you should go back. When I say 115 degrees, I don't mean everybody's going to hit that. That's 0 to 115 is normal, right? So it goes from, this is your 90, click, 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 down to your 115, right? The rest are all 45 degrees. So abduction is the ability for your hip to go out this way, okay? And that should go out about 45 degrees comfortably. It should be able to go across 45 degrees comfortably. Same thing with the other side, 45, 45, somewhere in there. Not everybody's going to be the same. It depends on what's happening in that joint. Okay, so here's your flexion coming forward, extension coming back. Sorry, my elbow doesn't really do it properly. You know, your abduction and adduction. If there's something in there structurally changing in the bone that's catching, I'm going to have some issues, and I might even have some things impinging in there, and then that's going to change my my mobility. But if it's not a structural thing in there, hopefully we can get that mobility back. The other thing that your hips do is rotate, okay, which is wonderful. So they externally rotate and they internally rotate, okay? And they should be able to do that comfortably without pain. So we are going to, in these mobility drills, work on all of those movements. You're going to get some flexion, extension, abduction, adduction, external rotation, internal rotation. Those are the movements of your hip.